Can you hear me? Okay. Good morning. I hope you wanted to be at Campus Safety and Health Services this morning, am I correct? And you're fortunate because we have a small group, so we can probably take more questions at the end that way. I'm Dr. Susan Northwell. I'm the Medical Director at Health Services for about the last 2 years. I have Joanna Casio with me up here in the front row. She's our nurse supervisor. She's very good at answering questions, or if you have special concerns about your student, I'm sure she'd be happy to answer them. And we also have Police Chief Peter Anders here. He's going to be speaking after I am. Basically, I'm going to just run through kind of the basics of health services. And if you didn't get one already, please stop by our table and pick up a pamphlet. I think that's going to be very helpful. And there are other useful information things out there and some kind of fun things for your students as well. Basically, Health Services is here to provide high-quality services to the Millersville University students and to our whole campus community. The next statement, it's a little complicated about to continue to assess determinants of health and current health trends in order to provide the most appropriate, cost-effective care in a campus clinical setting. Basically, to me, what that means is we're always doing surveys. We're keeping an eye on what's happening with healthcare reform to see how that's going to impact college health. Every year we do a patient satisfaction survey from our students. We also know what the most common problems are with our college students, and then we try to have the most cost-effective but yet up-to-date care for our students. So to me, that's basically what that means. We also try to promote disease prevention, help them make healthy lifestyle choices, and also try to reduce risk-taking behavior, and I think Chief will talk about that a little bit more too. And we're also here to demonstrate cultural competency for the population we serve. And we know that everyone defines quality of life by their own culture and value system. And I just want to let you know too, besides traditional four-year students, although a lot of students are becoming five-year students, it seems anymore if they change majors or need to get more things, we also have a fairly diverse student population here. We have quite a group. I think last time we checked, we have about 30 international students coming in this fall. We have a lot of vets coming back on campus, and I think that's going to be more too as the wars end. We have LGBT students here, and we did just all get Safe Zone training for that. We have a number of certainly different minorities represented here. We have students living with disabilities. We have a fair number of commuter students. That's very cost effective with the economy. And then we have a lot of non-traditional students. The oldest student that I had here was my age, so we have some older students as well. So whatever your student thinks of culturally, I'm sure they can find it here on campus. And our basic mission is care for sick and injured students. We've had some challenges through the years. Shortly after I was hired here was the fall that H1N1 came on the scene in the United States. So sometimes we have things like that facing us, sometimes it's more routine things. Just to give you a little bit of an indication of the types of cases we see, probably the number one thing is upper respiratory infections of different kinds, strep throat, bronchitis, sinus infections, ear infections. We also see a fair number of female problems, urinary tract infections, stomach viruses of various kinds. We work very closely with counseling. There's a lot of anxiety and depression on campus, so we work closely with counseling for that. We also see a fair amount of injuries, especially orthopedic injuries. Sometimes they're from the athletes that are injured on the playing field, and sometimes, unfortunately, if students make poor choices with alcohol, we see some alcohol-related lacerations and injuries and fractured hands and things as well. So that's basically caring for our sick and injured students. We also try very hard to help students maintain their health. We do free blood pressure checks. We do have a number of students on campus that already have hypertension that are under treatment for that. We have a fair number of students with chronic illnesses like asthma, diabetes. We're also here to do work physicals. A lot of our students do work part-time. We do driver's physicals. We do well women exams. We do a lot of student-teacher physicals. When student teachers are seniors, before they go out, they have to come to health services for TB testing, and then the state of Pennsylvania, they have to have an approved physical done too. We do allergy injections at health services. One thing to note, if your student is a student receiving allergy injections, they do need to get at least the first shot from their allergist or their home doctor. We prefer that since we're not the ones that did the allergy testing and aren't exactly sure how they're going to react, they should at least have their first allergy shot with their home doctor, just to let you know that. We do a lot with health education. We work closely with wellness and peer health educators. We can also do HIV testing and sexually transmitted illness testing. That used to be free testing. Now there's a small charge for it, but the treatment for STIs is free. Also, in terms of minor procedures in lab, that's a little picture of someone taking a fasting blood sugar or a finger prick test. We certainly do suturing, but that would be for more minor lacerations. I'm not equipped to do tendon repairs or nerve repairs. Those would go to the emergency room. We do wart treatments either with cold freezing therapy or burn therapy with hyfricators. We do have, it says limited, but I think really we have a pretty good range of on-campus lab services that we do right at health services. We can do rapid urines, we can do rapid strep and mono tests, blood sugars. For diagnostics, we can do resting EKGs. We do a lot of EKGs with the athletes to make sure that they don't have a heart problem that's going to show up suddenly on the field. We can do peak flow testing for asthma students. We can do rapid flu testing, rapid pregnancy testing, and we can also do microscope exams. The rest of the labs, things like chemistry profile, CBC, those can be sent out. And this is where, if you do have health insurance on your student, that becomes important. It can be billed to their insurance then, just to let you know about that. And most of our in-service labs, the cost is usually around $5. As regards our hours, we're changing this fall to a little bit shorter hours. We had a trial last year with a lot of the nursing staff doing 10-hour days, but that wasn't well utilized at the end of the day. So the last appointment's going to be at 5:30. We close the doors at 6, but Friday's the last appointment will be at 3:30. And really, in between classes, most students find they can certainly get in during some of those hours or with work hours too. Our present staff includes myself. We have 2 board-certified nurse practitioners. We have 5 nurses, and you met Mrs. Ocasio, who's our nurse supervisor. We have 2 office staffs, and then we had hired 2 student workers as well. Basically, the most important thing from this slide would be to look at the very bottom there, and we have history and physical forms that you can download online. Those can be faxed or mailed in. Basically, these are required for all students attending Millersville. They need to be completed by your family doctor or pediatrician, whoever your student sees, and it would include a physical examination, a TB screening, typically that's what's called a PPD. We really need their immunization history and then their medical history. So you can download that online, and I'm sure your students can download that online. If you want to find us, we're basically right across kind of catty corner from where the president's office is and from the library. We're on a little street called McCullough, but it's off the main street. You probably drove right past health services and didn't know it this morning on your way to the SMAC building. It's an older building, but I'm pleased to say it was renovated last summer on the first floor. So it is nice and clean and modern, and I think your students will enjoy it. Regarding fees, if you've read anything about the fees for your students for next year, you probably realize that you do pay a general fee, and part of that is for health services. The fee covers all office visits, some diagnostic testing that we do. We do every year have some free flu testing available from the state, and we do have quite a number of over-the-counter meds for free. So there's not a separate charge for that. Some wellness exams, for example, a well women's exam or a driver's license physical, there are fees for that. And then some tests and medications are available for nominal cost. It's important that you realize if you have your car all loaded up with all your students' possessions that they're trying to bring on campus, and you arrive and we find out that your student has not had a meningococcal vaccine, they can't necessarily move into the dorm at that point. That's a state law that all students living in a Pennsylvania college or university-owned housing have to have proof of that. They could sign a waiver at the time. I don't think that's really wise because the incidence of meningitis has proven to be much higher in students that live in a dorm situation. Last year, we did have some free meningitis vaccine. Not quite sure if we're going to be able to offer that this year or not. That was through a free state program. We are, however, going to have a limited number of flu shots available for students for free next fall. So tell your students if they want to call health services this fall and sign up for a free flu shot, that would be an important thing to do. Last year we also had free Gardasil, which protects against HPV. If you want more information about the meningitis vaccine, there's a link at the bottom for you. Regarding athletic physicals, these are required for all intercollegiate athletes. Most of our athletes here are Division 2. We have wrestlers who are Division 1. The only ones that require sickle cell testing right now are the wrestlers. However, if you have students in other sports and you'd like them to get the sickle cell testing, that can certainly be arranged. We are already doing sports physicals for the fall for returning athletes. For the new athletes that are coming, we usually do a lot of them as a group. For example, August 10th, we're going to be doing a large group of football physicals, but returning students can do them throughout the summer. So if you have a student athlete that's in a fall sport, they'll most likely be seen at Health Services for a sports physical. It's just to ensure that they're healthy before they start their heavy practices. And regarding insurance, insurance is not yet mandatory through our government's healthcare reform. We don't bill any insurance company, but it is important if you do have insurance on your student, please send a card or a copy of their insurance card along. Where this becomes necessary is if we have to do lab work on them, then it's important that we have that information available. The other thing would be if we have to send them out to a specialist or send them to the hospital to get an MRI, sometimes these things have to be pre-authorized. It can take one of our nursing staff sometimes 1 to 2 to 3 hours to get things pre-authorized. Makes it much easier if they have your insurance information ahead of time. So I would encourage you to find out more about your insurance from your insurance company, read the back of the insurance card, find out if you're from out of state or out of the area, what happens with the insurance coverage when your student is here at Millersville. Some insurances are fairly wide and will cover specialists and getting tests and procedures in Lancaster. Then we find some out-of-state students, if it's a bigger procedure like an MRI or seeing a specialist, some insurances require them to go home. So it's important that you know that so you or your student don't incur hundreds of dollars in out-of-pocket expenses. And it's a good idea, either give your student a copy of the insurance card or the actual card themselves, and if you can remind them to give us a copy at Health Services, then we have it. Then if they've forgotten it, then we have it available for them. It's one less thing they have to carry. There is a very good health insurance plan that I think is an excellent value through Consolidated Health. They offer insurance for all 14 of the PASHE schools in Pennsylvania, and because it's such a broad group of basically healthy students, they have good premiums on that. I'm not here to market for them, but if you want more information, you could call their 1-800 number or get on the website for that. Regarding prescriptions, as it says, we're not a licensed pharmacy. However, in Pennsylvania, we're what's called a dispensing pharmacy, that under my license and the nurses' licenses, we can be dispensing some prescription drugs. We don't honor drug cards, and we're not the same as a pharmacy that could use your pharmacy plan if you have a pharmacy plan on your student. You can contact the local pharmacies here if you'd like to, if you want your student to get their prescriptions from them, if you do have a prescription card. We can always write prescriptions. We also have available at very minimal cost. I was amazed when I first started working here, a lot of generic medications, and a lot of them start at $5. I think our most expensive antibiotic is $12. Our most expensive item that we dispense would be an asthma inhaler for $40. So the prices are very reasonable if your son or daughter does need any generic medications from us if you don't have a prescription plan. And we have a lot of medicines like skin creams, we have eye drops, ear drops, antibiotics, birth control pills. I could check for you if you have an interest in any certain item. And now we come to the part how to pay. And I know with the economy being what it is, that's really something we'll consider. I don't know if any of you saw the local paper. It looks like maybe they're going to have a 20% cut now for Pennsylvania State Colleges and universities, but apparently the state government's going to decide on Sunday some more about that. But basically, we make it very easy for your student. We find a lot of students do not carry cash, don't carry checkbooks. We take their Marauder Gold Card very conveniently for them. it's placed on a super bill. The other thing, it can go on their account through the bursar's office. So we do try to make it very easy for them, and we wouldn't deny them what they need. We would work with them. Sometimes students say, can you give me 10 minutes? I'll go back to my dorm and I'll get the cash too. So we wouldn't deny them services. It could be placed on their bursar account. And basically with confidentiality, I want you to know that if you call me and want to talk to me about your son or daughter, I can listen to what you have to say, but I can't really discuss their medical care or their condition or diagnosis unless they've given us signed permission to speak with you. I'm a parent myself. It's not that I'm trying to be rude when I say that, but that's so students aren't afraid to come to us with confidential issues. So if your son or daughter has a chronic illness that you want to be able to talk to me about, please see that during their first couple weeks here that they come over and sign a form that they say that I'm allowed to talk with you about things. I think most of you are aware about that. When you go to a doctor's office, you have to sign a HIPAA consent, actually. Here's how to contact health services. We do have 2 front desk people, but keep in mind, I think there are, what are there, Joanne, 6 lines, 4 phone lines? 6 phone lines with 2 people basically trying to answer them. So if the front desk people just politely ask you if you could just wait on hold a minute, or if they could call you back, they're not trying to be rude. It could be that the phones are very busy. You can reach us at the health services email address there at the website if you'd like to. I just wanted to tell you a few exciting things I think are happening at health services and on the campus for the fall. You were over at the new SMAC earlier, and they're going to have a grand opening in September for that. They're also going to have a health awareness day, so health services will be over there for that. We did recently receive some funding. We have a new breast health initiative, and I know maybe you're scratching your heads thinking, well, what does that have to do with college students? Well, the youngest breast cancer patient I ever saw was only 18 years old, and it's just a chance to get our students to be proactive, take good care of their bodies, for young women to learn how to do breast self-exam, and we're going to have more exciting things happening with that in the fall, and then we're going to have new things on our second floor of our health services. We're going to have a new breast health resource room. We're starting to look more into a women's center, and hopefully in the road maybe an international travel clinic too. This January, if everything works out, we're going to go to an electronic health record. Maybe some of your doctor's offices. Has anybody been to a doctor's office where they have electronic medical records? Anybody? Okay. We're going to be switching over to that, and I think part of the beauty of that is, number one, we're going to go paperless, and we can be much more efficient, hopefully, once we hit our learning curve with it. The other really exciting thing, hopefully we'll be able to communicate better with your student's home physician or with a specialist, or we'll get results much quicker for labs and for x-rays and tests. And I think it should provide the overall care with much more continuity. I just want to tell you too, if you do have a student athlete, we do have 2 very excellent full-time athletic trainers here. We work closely with them. If your son or daughter would be injured, they usually are the first ones on the field to evaluate them. They can do emergency first aid care. For football, there's an orthopedic surgeon that's on the field. They work with us and refer students back and forth with us as they need to. Also, if you have students that are interested in healthcare professions, we do have a nurse practitioner grad student that works with us every semester. We take shadowing from athletic training students. We've had some respiratory therapy students spend some time with us. This last year we had a pre-med or physical physician assistant student spend some time with us too. So we try to be very proactive in terms of helping to mentor, since this is an academic institution. In terms of what to send with your student, if they don't have any basic supplies, we do for free have a number of things such as Tylenol, ibuprofen, throat lozenges, a number of things. But if you can tell them if they can try self-care first, if they can bring a small hand sanitizer to campus, one that's pocket or purse size, those are very good. Maybe a few Band-Aids, triple antibiotic. If they could bring some Tylenol, ibuprofen, or Aleve, that's helpful. Cough drops, maybe whatever their favorite over-the-counter cold remedy is, ACE-Reps. Maybe a heating pad or ice pack. We can help them with a lot of those things at health services, but sometimes if it's the middle of the winter, they don't want to walk across campus, it's just very helpful. They can be calling, talking to one of the nurses, and the nurse can say, did you try this first? So those would be some of my basic suggestions. We'll try to take good care of your sons and daughters. My own daughter graduated from here in psychology in December 2009. Mrs. Ocasio's son is coming in as a freshman, so we really believe in Millersville, obviously. That's it. I need to give the chief some time. Does anybody have any questions that they'd like to ask me? Yes?
Just two questions, Doctor.
Sure.
One, what is the affiliate hospital that you would be referring to?
Okay, for affiliate hospitals, we really have our choice. There are 4 hospitals in the area. We refer, the 2 closest ones would be Lancaster General Hospital for their emergency room, or Lancaster Regional Hospital. If it's diagnostic testing and students don't have transportation, a lot of them prefer to go out to the health campus, which is out by Park City. That's one of the shopping malls. We can also use the other 2 hospitals. Some of our commuting students live in Lidditz, or the northern part of the county, so Ephrata Hospital, Heart of Lancaster Regional up in Lidditz, we can use any of those hospitals.
And are you the attending physician at that hospital then when they get transferred there?
No, I am not. We have an agreement with General Internal Medicine that's out on Columbia Avenue. So what would happen if your son or daughter would have a life-threatening emergency and they're brought to health services, we would call 911, get an ambulance out, have them go to the nearest ER of their choice, and then they would have the ER doctor evaluate them, and then if they need to be hospitalized, it would be through General Internal Medicine Associates. I've been in family practice 32 years and used to do a lot more hospital care, but it just is more efficient this way, and I don't think we have even maybe one hospital admission a month even. Basically, we have a fairly healthy group of college students, but just to let you know what would happen. And if they can make it to health services, you know, that's fine, because we can do some first aid and do some stabilization till the ambulance gets here. But in case it's an emergency where, you know, 911 needs called, and Chief can tell you more about that, but a police officer would go, they're first responders, and they can also help stabilize a little bit until the ambulance can take over, but they're not meant to be EMTs. But if they can possibly make it to health services, that's a good way to go, because we have oxygen, we have splints, we have Benadryl, acute allergic reactions. We had a professor come over with an acute nut allergy. This spring we got to try our skills with that, and the ER came back and said, she was very kind, she sent us flowers and said we saved her life because we knew the right things to do with that. I'm not bragging, but just, we do have little emergency things we try from time to time. Yes, ma'am?
Yeah, you close at 6 o'clock, I mean,
yes, we do.
Allowed in at 5:30. After hours.
What's available after hours?
Do you have somebody on call, or, I mean, in case of emergency after hours?
That would be a nice situation if we did have someone on call. Basically, a lot of the RAs and GAs do have little first aid packs if it's something minor that they need a Band-Aid, or they need to be able to check a temperature or have Tylenol or that sort of thing. If it's something where they need to be seen that night, if it's more severe, they can go to one of the emergency rooms, where we do have, I think, 2 to 3 now, urgent care centers in Lancaster County. Most of them do take insurance, or they, for a fee, will see your son or daughter after hours too. Health services, before I came here 2 years ago, used to be open 24/7, but due to budgetary restraints and funding cuts, and then it was actually becoming dangerous for the 2 nurses that were there all night by themselves. A lot of it was dealing with intoxicated, dangerous students, so for a variety of reasons we're not open all night anymore. But we certainly do care about your son or daughter, and a lot of times the ER will have them follow up the following day with us. And if we're there and send them to the ER, we try to send along paperwork or call the ER, let them know that they're coming. But that's a good question. In the ideal world, we'd be available, but I think we do have good coverage after hours. Yes?
How would they get to the hospital then, if they need to go after hours?
If they need to go after hours, usually if it's a first-year student and they don't have a car available on campus, a lot of them will have a friend or something that can take them. But if it is an emergency, if it's something that's more serious, basic ambulance transportation, or during the hours we're open, if they don't have transportation, sometimes we give taxi vouchers, or we have one of the security staff that works with the MU Police Department at times available for transport during the daytime. But it usually does work out. Good question. Yes?
You mentioned self-administer meds, understood. Are they allowed to keep controlled substances in their dorm?
Oh, that's a really good question. I'm sorry I didn't answer that. I do think if they have a controlled substance, if your son or daughter is on a stimulant medicine for ADD or ADHD, I think it would be good to keep a little lockbox. Maybe not that they wouldn't trust their roommate, but if the roommate has friends in or there are people in their room that they don't know, sometimes medicines do get stolen. In terms of stimulant medicine too, probably once or twice a semester, I see a student that's borrowed their friend or roommate's ADD medicine, and they're up all night and they come in with heart palpitations, real high rapid pulse, high blood pressure. They look red, they're really scared, they promise they'll not again. But I think it is good, or if your son or daughter is on anything, chronically for pain medication or that type of thing, to keep it locked up.
So they are permitted to, with a lockbox, to have that in the room?
They would be permitted to do that. And with ADD, just to touch on that, or ADHD, if your son or daughter has ADD or ADHD, a couple ways you can go with that. One is Wiley's Pharmacy here. If you still want their family doctor or pediatrician to keep prescribing that for them, Wiley's can arrange that they can get that filled once a month, through the prescriptive authority of that doctor. I will write for some ADD meds, but in order to do that, I need documentation that they have legitimately been diagnosed with it by a licensed psychologist or by a psychiatrist. And if I have the documentation, I can do that. But I just have to be very careful of not being conned by students. So it's not that I don't believe your sons or daughters, but that's why I do that. Some colleges and universities have gone as far as doing mandatory urine testing on students to make sure they're taking the meds and not selling them. But I'd say by and large, I really haven't had any problems. As far as I can remember, no stolen prescriptions. We keep those very carefully. Other than the occasional ones that borrow the medicine when they want to stay up all night, they think it's going to give it an edge, but actually they usually miss their test the next morning then. And we do have, I just want to mention, I don't think they're speaking this morning, we do have a very good counseling department here. They have 6 to 7, I think, licensed certified counselors. We also do have a licensed clinical psychiatrist that comes in a half day a week. If you have a son or daughter with bipolar or schizophrenia or more severe mental illness, they can be seen through counseling. We refer back and forth a lot. If I see a student I think needs longer term counseling, we refer to them. Or in family practice, I did quite a bit with anxiety and depression, so I feel comfortable with using some mild medications for students too if needed. Hope I answered your question with that. And we do collaborate with a lot of different departments, such as the police. We collaborate with counseling, campus ministry, housing. I think they had only one bed bug scare this spring, so I'm happy to say that we haven't had to have the sniffing dogs out or major problems with that. I don't want to go over here. I need to let you go. Just one more question? That's it? Okay, you can talk with Mrs. Acosta or myself afterwards if you'd like to. Thank you for coming.
Thank you.
Mm-hmm.
I would have been okay. I was enjoying
Oh.
listening to everything, so you could have gone over. Got a lot of stuff on here. I couldn't get it.
He's got some really fun
This
things
is
on
this is
there.
a little busy. They gave me a disc this morning. I just started here in January. Here, I'll show you this one though. That's me when I was a rookie officer in Langston. So I do have a sense of humor. I just started here in January. My quick transition is I'll tell you that without question, Dr. Northwell's hire, and I went here in the 80s, so I'm a Millersville graduate. Dr. Northwell's hire, in my opinion, was a real home run. So that, my wife graduated from here, and I have 3 daughters. So probably the most important thing that I could say, everybody can hear me, right? I have a fairly loud voice. I have 3 daughters. My oldest will be in high school. I'd be comfortable with any of my girls going here. So that's same for both safety, security, and education. My wife's an elementary school teacher. I graduated with an undergraduate in psychology. I think the students that are here now, and they're not perfect by any means, but basically we have a really a bunch of good kids. I'm going to shoot through this pretty good. I didn't create this PowerPoint, but I am going to go through it pretty quick just to leave a little bit of time. You guys asked great questions. That was the other reason why it would have been sort of okay if Dr. Northwell kept going, because I'm sure you'll pepper me up too. We are a full-service law enforcement agency, so basically we do everything else that the state schools, our state universities are all state-owned. So compared to private colleges basically have security. They can come under what's called the Private Police Act, if anybody's familiar with, and then also take something where they can carry guns. So some universities or colleges like Bucknell have gone that route and have pretty good security departments. We have the ability, we have right now 15 officers on staff, including me. We work 24/7. We always have at least 2 officers that are out on campus. We also have a very functional relationship with our surrounding agencies. Lancaster, as you'll see later, is 3 miles away. Lancaster, when I was there as a captain of patrol and captain of detectives, they have 141 officers right now. Millersville Borough, which we're in, the university is in the borough, has about 14 or 15 officers, and we have surrounding townships that we have functional relationships. Those relationships are so strong we don't even have mutual aid agreements. My kids, as I said, live here. I live 3 miles away. So we're actually in the school district Penn Manor where my kids go to school. My officers know that if they don't respond to something that would occur at the school, they'd have a very real problem if it was at one of the Penn Manor schools, and vice versa. If there was something that occurred here and Manor Township or Millersville Borough officers were free and didn't respond here, I'd have a real problem with that as well. And we've had those discussions. We do active shooter training, an awful lot of training together, and we also find that to be costly. So to continue, we enforce all laws, criminal and traffic. The traffic don't get a lot of smiles when we enforce that, but it is a safety issue in a congested borough. We also enforce university policies, including parking. We can respond, and actually I should say we do respond off campus. We patrol primarily by vehicle right now. We also have several that are bike trained, including me. I have yet to get on the bike, but I promise to do that next year. And also, but what I have done is foot patrols. We also have one of our vacancies that we are filling as a officer position in the resident halls. We have a guy who's retired out of Reading City, phenomenal guy that we expect to have before orientation starts this summer. These are some of the challenges. 8,000 students in a town of almost 10,000, rural setting of 250 acres. Less than, everybody I think knows where we're at. 17 to 23-year-olds with little supervision. I don't know if that's quite accurate. I didn't make this up, so, but it is a reality that is a busy time period. And I think, the bottom one, adjusting, especially if for kids that grow up without siblings or are fortunate enough to have their own room, all of a sudden getting thrust into somebody who maybe they were friends with and all of a sudden realizing, hey, this isn't going so good. And also changes within diversity. We're a diverse campus. As a police department, we celebrate diversity and more importantly, we protect diversity. And that's both with same-sex partners. We have a active, perhaps not large, but we have an active LGBTQ community on campus. And we've also had, as many college campuses, we've had protest groups come in, from outside our state that have protested everything from funerals to race to sexual preference choices. So on those, we unfortunately, I'm not going to say unfortunately, on a personal level, at times I find it unfortunate that some things that are appalling, like protests and funerals, are protected by First Amendment. However, we will protect First Amendment rights, but we also are very careful to protect our students from being assaulted, which has happened in other places. How bad is crime? At Millersville, I can tell you we're in one of the safest parts of the nation, but we will go into that, and you can get more statistics online. What are you doing about crime at Millersville University? We're very proactive, and we collaborate with a lot of others. Can my son or daughter have a vehicle at Millersville University? My suggestion is no. Parking, when I was in charge of patrol in Lancaster, which is very busy, I got more complaints about parking than anything else. And it was ironic when I came through the search process, which was national here, they asked, well, we have a lot of parking complaints. I sort of smiled because it is one of the top complaints here. And I think it's a reality check because in a lot of areas when they go out, especially if they live in an urban area, they're going to find they're going to pay a lot for parking, and that you're not going to park necessarily like you do at going to Giant or a shopping mall, and you find that place that you can even pull through and get out. You may have to walk a little bit. There is a lot of parking at Millersville University, but there's not a lot of parking that's 20 feet away from the building you're going to go to. So that's a frustration. A lot of times, I'm a last minute guy. I tend to be that way. I've always been that way. But if you're looking to go to class a minute before and arrive a minute before, you're probably not going to find a parking space that's a minute walk from your class.
Question.
Yes.
Do you need a car just to go around campus?
Absolutely not. It is perfect walking size. I walk from one side where the gym is to the other side where athletics is, the entire side of campus, and I think it took me 8 minutes, and I wasn't hustling. So, will the university police tell me if my son or daughter gets in trouble? It just depends. That answer, and we'll go into that. Short answer is it's drinking related, yes, and the other answer would be if they're cited, you will be contacted most likely in one form or the other by the university. And it's also public information, so you can regularly check on public dockets to see if your son or daughter or your neighbor or anybody else for that matter has been arrested. Crime at Millersville about average compared to the other 13 Pennsylvania State universities. Are there any Millersville grads here? Just curious. No? Okay. Millersville University usually ranks in the middle, just about where we are in campus population. Exact statistics can be found on site. Theft is our #1 victim crime, and again, that's a crime of opportunity. If you leave something somewhere, anywhere, whether it's here or somewhere else, you can be a victim of that. I also didn't make these, but I do like some of these, so I'll definitely keep. I don't know the guy with the prowler. So, textbooks, what's often stolen? Textbooks, electronic devices, clothing, credit cards, cash, and electronic, the cell phones and laptops. Elements of crime and opportunity, those are basically, they say there's 3 elements of crime: desire, ability. You can't change a lot of times when somebody has a desire to commit a crime, especially as a victim. What you can change is the opportunity, being very present. And I tell my family that all the time, that you should be aware of your surroundings. The key to property protection is locking the door. Other tips, and I'm going to go through this pretty quickly because I want to leave some other time for questions. These are also on our website. Remove valuables from parked vehicles. That's the biggest thing, and that's just for parents too. I've had relatives, including my wife, who have had their stuff stolen out of their car when it was unlocked. The other is reporting suspicious persons to the police at the bottom. We do make notification if there's a crime spree on campus, and we'll also make notification in the residence halls. And it's also printed in the Snapper or the student newspaper. Drugs and alcohol. Millersville is a dry campus. We have strict drug and alcohol enforcement by the police. We are going to be very, very open to, and that may be a bit of a change for some within the university and especially with the police. But I have had past experience with alcohol-related deaths, which are really difficult to deal with. And one of the things we're going to look at is something that we embrace, like a Good Samaritan type policy. I think there's a lot of value to it. I think it also deals with reality. We have a lot of students that do not drink on campus and go through their entire education without drinking or binge drinking. but I'm a realist, and, you know, if we have an opportunity to have somebody who says, hey, it looks like this guy's in trouble, but they've also been drinking themselves, the last thing I want them to worry about is whether we're gonna prosecute them because they're calling in, and reporting that the other student looks like they're in trouble. So that's the short thumbnail of the Good Samaritan policy. Underage drinking convictions, you can go through that. Drug possession, we do have, periodically, and I'd say the number one drug of choice is marijuana. We do periodically have arrests for that, and we will prosecute for that. We also will work with the district attorney's office if there's dispositions that would be in the best spirit. You know, that's basically up to the district attorney and the district justices. If they are at a certain level, they will be sent to the hospital, and we'll have them transported by ambulance. And that sort of is a reality on ambulance costs, whether you're a student or non-student. Ambulance cost is an expense, and but we're very careful. I'm not a physician, and after hours, we're careful with making transports and also with holding, because we're responsible for somebody for holding. Risk of victimization increases back to 90% when somebody's under the influence of drugs and alcohol. This year, starting in January, we had 2 or 3 incidents that were just off campus, where students were assaulted or involved in a mutual fight and got injured, and everyone that I was familiar with was alcohol related. We have worked, and our officers on patrol out, so we actually are officers, because it's a relatively small campus. It's a smile for students when all of a sudden they say, hey, there's Officer Melvin, and there's Chief Anders, and I've gone out on the evenings as well, and introduced myself to some of the students on a Friday or Saturday night at midnight. That's something we're looking to do, actually, you know, really for protection. And you know, so, and if my daughters go here, which isn't a big if they decide to go to college, they could pretty much will be going here. They would have the same smile. So I'm sort of looking forward to that time period. What are you doing about crime at Miller's University? We have over 30 campus emergency phones. I really think the biggest value is a perception of safety, and then, you know, the feeling of feeling safe. Most of them are within an eye shot of each other, and then it also is an amount of a deterrent. Our biggest activations are actually kids that, you know, are passing through. We have summer camps, so we actually get more activations in the summer where kids just, you know, walking by. We have campus escort service between 11 p.m. to 7 a.m. Where somebody's in trouble, and we're actually working on a student group, or with a student group that's also providing I'm going to forget remember the name of that? With a student group that's looking to do that, which I think will actually increase the number of escorts across campus, because they'll feel, you know, hey, if I call the police, maybe the police will realize that I had, you know, a drink, or so we are working on that. Emergency notifications, parents can sign up for this as well. This is email blast, which means that if we're going to have a closing for school, if there's flooding, earthquake, anything else, we send out emails, text alerts, and that's through what's called MU Alert. Again, that's on our website. It's on the main website as well. There's also, we have loudspeakers if somebody's outside on athletic fields, they'll be able to hear. We also have reverse 911. As we take phones off of campus, it's probably going to be less and less. But the other positive of that is we have, I think there's over 9,000 people signed up with the MU Alert. I'd like to see that number climb. And then timely warning notifications. It does work. This is a copy of what it looks like. Stay off, if we have one, and we practice it. Stay off campus. If on campus, lock yourself in a room. Those are the type of, or another one would be, there's tornado warnings coming in, find a place to shelter, or school closings. Threat assessment team. Your kids are going to get, what I'm giving you is sort of a thumbnail of what they're going to get very, very extensively when they come here for orientation. We established a threat assessment team on campus in 2008. I'm involved with it. The number 2 person at the university is also involved. Just got to make sure I leave a little bit of time. Dr. McCollum, my boss, Dr. Brown, is also involved. We have counseling, nurses. It's really a collaboration. And what that's for is if somebody's having a mental health problem, appears to be a threat, they're acting out. Basically, they're on campus, and it's not just for students, it could be an employee. We have numbers for them to contact, and we'll come together. What's nice is I can say, hey, you know what, we had some recent contact. This is a junior. We didn't have any contact with this person before. And then all of a sudden, you know, health services might say, yeah, I had some contact. They weren't sleeping, and counseling might have some contact. So when you look at something holistically, it's like, hey, we need to make an intervention. Doesn't mean that the kid's going to be kicked off, or student's going to be kicked off campus, or employees going to be fired. But it is a way to basically try to get help to intervene before you have an incident. And most of the, you know, the elephant in the room is the school shootings. Most of the school shootings that have occurred after fact, when you hear reports, students, faculty across campus would say, geez, I knew that bad stuff was happening, and unfortunately there wasn't a collaboration. So I think that really decreases, it doesn't completely eliminate, excuse me, but it decreases that opportunity. And really that's, you know, everybody goes through, this is one of the most stressful points in your life. If you went to college, you know, relationship breakups, moving away, deciding, hey, your junior year, which I did, I don't want to be a teacher anymore, I'm not sure what I want to do, and then going to psychology and saying, geez, I don't know if I'll get a job right out of college. You know, so there's a lot of stressors, you know, that we have the help here, and hopefully can identify and get students, you know, sort of, if they make a little bump, sort of gear back. We have AEDs in all our vehicles, and they're across campus. Not only do we do training, we have another health officer on campus, Jonathan Driscoll, does training. Rape aggression defense, RAD, if you have daughters, that's something they can check out. I believe in it. It's not just, you know, about doing kung fu or karate. It's actually more about having the mentality of not putting yourself in a position where you're going to be exposed to things. We have video cameras, which we're using, and actually almost all new buildings are getting put in with CCTV and cameras where we can monitor what's going on. Bike registrations, Facebook. Can you? I like that photo. I don't know if it's appropriate, but anyway, you know, creative parking, I guess, is what he was looking at. Can you have a car at Millers University? It's limited to students with 30 or more credits. However, medical needs, military, education needs, there can be exceptions for that. Then there's a lottery system for open spaces. Parking is strictly enforced. I would encourage for incoming freshmen to not try to find a way and for parents to not try to find a way, if you have a medical or military exception, you know, I understand that, but you will make things more congested, you know, by trying to find a way to bring a vehicle to park or a vehicle to campus if you're living here. So parental notification, I sort of went over that. We are required by law, as is every other police department in the state of Pennsylvania, to make notification for juveniles, and juveniles doesn't mean under 17 for liquor-related offenses. It's under the age of 21. This 2 and 3 are a little bit of a conflict. Can't release info to other parents for other offenses, but they are a matter of public record. There is an act that limits us, similar to HIPAA, it's called CREA, that limits us in our ability to release information. However, we work parallel but separate when we have an investigation on campus with the judicial code officer, which is Lori Austin. And Lori Austin, through the judicial or the student code of conduct, can impose different sanctions on a student who violates the law. So there is a strong chance that a parent would be notified. And not only that, but again, when I've been called, which I've already been called this year, I've just said, you know, if you have a concern that your student was arrested, you can go to the public docket. I'll even just give me your email. I'll give you the email, and you can check for yourself. Summary: we are a safe campus. We're not perfect, but I think we do a really good job, and we work with others. We have an administration, and this is absolute. This goes right up to Dr. McNary. I didn't apply to anywhere else. I applied one place, which was here, and I liked my job before I left it. I didn't have to retire. and I'm not collecting a pension from there. So it would have been actually easier for me to continue staying. I will, at an age, collect a pension, but I like Millersville from when I went here and from coming back. So, you know, part of that was seeing that Millersville, when I was a student to now, has really had a pretty strong direction on the top point about trying to keep things safe and healthy. Millersville University works hard to comply with all provisions of the Campus Right to Know Act and the Clery Act. We have a right to know officer, so if there's ever a question, if you call, and my number somewhere, it's not on this, but I'll give you my phone number. My desk phone number: students must accept some responsibility for their own safety. We can't do it alone. That's a principle in policing everywhere. Community policing, it's called that for a reason. We do community policing. It's not policing community policing. The community's engaged, things are going to be safer. And here's our contact information. Non-emergencies 3433. My phone is 3434. And we have a dispatch. We're probably going to change the way we do our dispatching. Matter of fact, I just had my boss up yesterday at the county dispatch 911 center. We monitor and get dispatched by the county 911 center. So that's probably being told. We got to start shooting up here. My guess. Quick questions or any questions?
So you can notify parents for alcohol-related offenses, but not for drugs?
We probably will for drugs too. I can say that if I'm gonna lean on the side of disclosure for the right reasons. And you know, basically the standard for those kind of disclosures is a reasonableness. And I think it's reasonable. You know, so I've had arguments with students over that, and I say, well, you know, I understand that, and I've been sued, you know, when I was a Lancaster. I'm not looking to get sued either. But I can tell you that I think it's reasonable, and if somebody's using drugs, that's a problem, because ultimately there's going to be an issue with them at school, and it can affect where they're going. So I look at it, I'm not going to be notifying, but it'll probably be in the paper, and if it's in the paper, whether it's in the paper here or in Lancaster, it's public record. So, you know, my reasonableness on that is, if I'm telling somebody who I think would care about them, like their direct relative, I see that as a positive. But the more likely path for that would be out of the judicial end. Yes?
You mentioned some natural disasters. I live in a hilly, wooded area. I always laugh off tornadoes, floods, things like that. Are these the disasters that you're talking about in Millersville, and will they be trained in how to deal with those? Since I obviously was a bad parent, I didn't train with them.
Yeah, we actually have, and they're going to try to extend it down. I just talked to her yesterday, Dr. Seppi, what's her last name? I don't even know.
With the emergency preparedness.
Yeah, we have a master's. We're the only state school in a system that has a master's degree in emergency management. And I just talked to her yesterday. I'd like to see us change where our station is. I told Dr. Northwell that I'd like to be her neighbor, you know, sort of like Mr. Rogers, and right on the main drag on campus. But I'd also like to partner with our master's degree in emergency management, because there's so much crossover. And so we've worked on that since I've been here. Dr. McNary, the president, actually participated in a tabletop exercise in which we went over a campus emergency. And so the students are going to, right now, I can tell you that those type of plans, to some degree, for the right reason, aren't completely thrown out. But evacuation routes, some of those other things, this summer, I hope that they're going to be much more pushed out, because your kids, and not just kids, the campus community, staff, and everybody else should have a pretty good idea of where to go if there's an emergency. Yes?
Just like the doctor, where she said, if there's a sign of authorization to discuss my child's medical record with me, she will have it on file and discuss it. If I pay my child's school fees, and that child is on my insurance, and I have a signed application for the campus police to discuss anything about him with me, would that be honored?
I probably would honor it even without that. So,
Yeah.
like I said,
if that child is 21, it's just a
yes,
regular.
yes.
Because my daughter wrote a paper on that. you're 21 to drink, and at 18 you're an adult. It's a dichotomy that.
Yeah, well, the state law actually says that if you're 19 or 20, that you have to make parent notification or reasonably attempt to. And for us, it's that reasonable. We're gonna make every effort to make that
I want to know what
attempt.
my child is up to.
Absolutely, and I think that's reasonable, and I think that's part of the reason that they made the state law go past the age of 18. So,
I feel comfortable. Thank you.
yes.
Public record, how do we access those?
The public record goes through Steve DiGiuseppe, I think, and it's there. If you go on the site, there's a search feature, and I found it to be pretty good because I'm continually going. Even though I went to school here, I'm reacclimating myself. Like I went to one building, I realized Stair is no longer Stair, it's Jefferson. So then I had to walk somewhere else, and I'm always last minute anyway, so I went late to a meeting. But if you go on the site and use the search feature, you'll find, or I think even if you go to, there's one of the drop-down boxes, we'll say by department. I think if you go to R, it'll be right under right to know.
The police department?
The university has a right to know for the entire university, so you could ask almost anything and they'll respond. If they don't think they have to tell you, like there may be some things like protected health information or counseling, then they would consult with their attorney. With police, the strongest area that we will not release is if there's an active investigation. So if your son or daughter is accused of doing something, we will not release what's going on with that investigation until it's completed. And that's very frustrating. And I realize that, you know, I'm the youngest of 5 in my family. I've had nieces and nephews that have already graduated. So I understand that frustration from the one end, but that's one of the things that from the law enforcement end, there can be, it can just put hurdles if we're doing that and not attending to the investigation. So, okay. And all our other stats, though, should be either up to date or in process of being up to date. And that's on, if you go on the MUPD part of our website.
Thank you all for coming.
Thank you.
Appreciate it.
Thank you very much. Thank you.